So here we will discuss about post-pill amenorrhea. Post-pill amenorrhea occurs when stopping oral contraceptive pill does not lead to the restoration of the menstrual cycle, meaning the loss of menstrual cycle for 6 months after stoppage of taking of birth control pills. Why does post-pill amenorrhea occur? Is believed to be due to suppression of pituitary gland by the birth control pills. তাহলে so there is stoppage, there is suppression of the pituitary gland due to suppression of the pituitary gland by the birth control pills. The birth control pills have stopped. The birth control pills have suppressed the pituitary gland. So when we stop taking the birth control pills, or when the subject stops taking the birth control pills, then the follicles will not be produced. There will be no ovulation, resulting in amenorrhea. What are the investigations? Investigations are usually needed if menstrual cycles do not resume after 3 months of post pill. So, if the menstruation does not return within 3 months after stoppage, then we are to do some investigations. It may be the cause of amenorrhea started whilst taking the contraceptives, which induced an artificial cycle, making the issue until they were stopped. So what we will do? We'll go for an ultrasonography. Will reveal ovaries with no signs of developing follicles and ovulation even after having stopped the pills for 6 months. Blood tests can be done, which shows a low level of follicle stimulating hormone and luteinizing hormone. Estrogen is usually sufficient to confirm the diagnosis. So we will go for some blood tests to check follicle stimulating hormone, luteinizing hormone, and gonadotropin releasing hormone. Follicle stimulating hormone, these are gonadotropin releasing hormone and estrogen. We will also test estrogen, which is usually sufficient to confirm the diagnosis. Uh, the treatment, the first line of treatment in case of post-pill amenorrhea is waiting for spontaneous remission of the amenorrhea and the spontaneous occurrence of periods, and the time limit is usually 6 months. We will wait for spontaneous remission of amenorrhea. We'll wait for spontaneous remission of amenorrhea. The time limit is usually 6 months, but if the woman is anxious to get her periods, active treatment may be started after waiting only for 3 months. The standard treatment for post-pill amenorrhea is by stimulating the pituitary to produce follicle stimulating hormone and luteinizing hormone. This is done by drug clomiphene citrate.